Hello again, everybody, and welcome to another Inside Lowell podcast. I am your host, Teddy Panos, coming here from the Wellpoint studios here in downtown Lowell. Wellpoint, your whole health is their whole point. And we thank our friends at Wellpoint for helping to make this podcast possible, and all of our podcasts possible for that matter, along with the rest of our podcast sponsors here at Inside Lowell, starting with the Washington Savings Bank. Make the switch now to Washington Savings Bank. TMI Properties, from affordable to luxurious, apartments for all. Boston North Company, business solutions for restaurant and retail. Mahoney Oil, providing warmth and protection to Greater Lowell since 1925. Francis C. Preventure Insurance, the agency Greater Lowell has counted on for more than 41 years. And the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Mill City. And with that, I want to bring in our guest for today's podcast. She is the medical director at Wellpoint, which we talked about. We're here in the Wellpoint studios, and she joins us every month to kind of give some tips and focus on a different health-related topic. Dr. Carolyn Langer. Good morning, doctor. How are you?
Good morning, Teddy. Good to be here again.
It's great to have you here. You're with us every month, and this month you want to focus on preparing for a doctor's appointment, which was interesting to me because I never thought, other than, as I kind of joked off air, other than showering or putting on some clean clothes, prepare for a doctor's appointment. Why is that such an important thing?
Yeah, it's really important that you prepare in advance for a doctor's appointment so you know the questions to ask, so you understand the information that you receive from the doctor. So there is some homework you can do before you go for your doctor's appointment.
Well, so what is that homework? What should I do to prepare? Should I start going out on the web and searching and whatnot and going in and basically telling the doctor what I need to do?
No, Teddy, it's interesting. Whether you're going for a regular checkup or a sick visit, there are certain things that everybody should do. So you want to get some information prepared in advance. So, for example, you should compile a list of the medications you're taking, not only prescription medications, but also over-the-counter medications, herbal supplements, vitamins. You may want to engage family and friends to help you think about questions to ask the doctor. And then it's really critically vital that after your appointment, you understand the information before you even leave the doctor's office. But here again, this is where family and friends can really be helpful. When you come home after your doctor's appointment, make sure that your family and friends understand what the care plan is, and ensure that you understand what that care plan is. You may even want your family or friends to participate in a virtual visit so that you have somebody else listening and hearing the instructions from your healthcare provider.
Wow, that's actually really interesting, and making a list of everything I'm taking, because you reminded me, it happens to me all the time. And at my age now, that list is getting longer and longer. But even if I'm lucky enough to remember all the items I'm taking, I may not remember the dosages, which is another important component.
That's right.
That is a great tip.
Right.
In terms of asking the questions, though, what type of questions are okay to ask? Because after all, most people, they're intimidated, right? The doctor is somebody who spent, a dozen years getting educated. And you, when you're talking to somebody who's such an expert and so knowledgeable, people tend to feel intimidated. So what's okay to ask? What kind of questions should I ask?
First of all, you should not feel intimidated. That's why the doctor or healthcare provider is there. And it is so important that you understand information about your condition and understand your care plan, because if you don't understand your care plan, you won't be compliant with the treatment. So some of the things that you should feel comfortable asking your doctor are things like, what can I do to prevent or delay the onset of health problems? Are there certain changes I should be making, such as lifestyle changes, to prevent conditions from arising? And if I do have any changes in my healthcare condition, what should I be doing in terms of doctor's appointments, the frequency of visits, what sorts of screenings, preventive screenings should I be having? Mm-hmm. Are there other tests that I should be having based on my age or other risk factors? And finally, I would say, you really want to understand from your doctor how often you should be coming back for regular well visit checkups.
Should the way the conversation goes or the way I go about asking the questions, should it depend on whether I'm there for my annual physical or if I'm there to treat something specific, a specific symptom I've been having or a specific issue I've been having? Does it really matter?
So there might be some differences in the questions that you ask. So for example, if you're having symptoms, then you're getting diagnostic care, which is really to help you determine the cause of your symptoms. So if you're going for diagnostic care, that could include appointments, certain tests used to diagnose an issue. If you go to the doctors for diagnostic care, you do want to make sure you understand your condition. You want to make sure you understand what the treatment plan is so that you can adhere to that care plan. So you may want to think about asking your doctor certain questions when you are going for diagnostic workup of new symptoms. So for example, you want to know what the name of your condition is. You want to know what caused it. Are there things that you can do to better manage your condition or treat your condition? How long is your condition expected to last? How long would you anticipate having symptoms? Some other things you can ask your doctor are, where can you learn more? You know, there's a lot of bad information out there on the internet. And so your doctor or your healthcare provider can help direct you to reliable sources of information.
So I've left the doctor's appointment on many of occasions with actually more questions than I had, as during the thing. Sometimes they'll find something else or the diagnosis will go in a completely different direction. Does anybody ever leave a doctor's appointment like confident, especially once they get a new diagnosis?
Yeah, unfortunately, a lot of people do feel intimidated to ask questions. But again, that's why your healthcare provider is there. And you should not leave your doctor's appointment unless you truly understand what your condition is and what the care plan is. Again, because the more informed you are, the better you'll be in a position to manage your care and to adhere to your treatment plan.
And all of this that we've just discussed kind of dovetails to something we've talked about many, many times, the importance of having a primary care physician, right? Because you develop that comfort level with repeated visits as opposed to, a specialist who you'll see, God knows how often. Hopefully not too often, right?
Yeah, no, absolutely. And people who have a regular primary care provider tend to have higher rates of preventive screening as well. So it's important that you do continue to establish that relationship with your primary care provider, not only because it will make you feel more comfortable raising questions, but also it will lead to better care in the long run.
All righty, good information. Prepare yourself a little bit before your next doctor's appointment. It will help immeasurably. Dr. Langer, as always, thank you for the time. Thanks for joining us for this Health Minute by Wellpoint.
Thank you. It's been great to be here today, Teddy.
All right. Always good to have you. And thank you for joining us as well. We hope you learned something from this Health Minute brought to you by Wellpoint. Till next month, everybody stay healthy.